I'm the first to admit I'm far from perfect. But when you say do over, I really can't see something that I would do completely over.
Yeah, that's akin to I'm so humble. Farewell, Fauci. Once known as the nation's top COVID doc, the embattled NIH director is finally stepping down as a federal employee tomorrow. But while Fauci says he has no regrets from his handling of the pandemic, our next guest has a few ideas and wrote them in his new op-ed titled, "Fauci Leaves a Broken Legacy for His Successor." Fox News medical contributor Dr. Marty Makary joins us now. Doctor, good morning. Thank you for joining us. Thanks for this op-ed. My biggest takeaway here from this op-ed is that you feel like he had the opportunity to be much more efficient and effective in funding the research and getting it out to us. Can you explain that?
That's right. People forget that he was the head of our National Institute of Allergy and Infectious Diseases, and the report card on that agency is pretty bad after this pandemic. Now, people are angry with Dr. Fauci for his changing recommendations. Really, it's just a symptom of a much larger and deeper problem, and that is the failure of this agency to do prompt research quickly to answer the big controversies in real time. For example, whether or not the virus was airborne or spread from touching surfaces. That was answered in an August 2021 study, a year and a half after the pandemic began, with a press release titled Hamster Model and Airborne Transmission from that agency. And if you look at what they did not study, it is amazing the list of things that they did not study. With all of their funding, $6 billion, and the vast laboratory facilities and staff that they had at Dr. Fauci's leadership, they did not study masks and boosters in young people and natural immunity and vaccine complications and Paxlovid in vaccinated people. Yet they spent $1.2 billion on long COVID, which has yielded nothing. So it's really a failure of science. And many times when Dr. Fauci said the science changed, the reality was that it was not done.
No, I really appreciate that. You talk about the science change. Well, maybe the science was never done correctly or done at all to begin with. That's such an amazing statement. And it is quite ironic that most of his guidance in the late summer and fall of 2021 really echoed what a lot of Republican politicians and doctors, or not Republican doctors, but doctors that weren't partisan, were saying. And let's take a look at one of those. Here he is on CNN talking about natural immunity.
There was a study that came out of Israel about natural immunity, and basically the headline was that natural immunity provides a lot of protection. Should they also get the vaccine?
I think that is something that we need to sit down and discuss seriously, because you very appropriately pointed out it is an issue, and there could be an argument for saying what you said.
Doctor, was it ever ethical to begin with to downplay natural immunity the way they did for so long?
No, it was unethical, and not only that, but they sort of hushed any research that came out in support of natural immunity, and there were over 100 articles. If you look, Joey, at the top articles in the scientific literature in the Journal of the American Medical Association in the past year, that is our #1 circulating journal in medicine, they were the mRNA vaccine found in breast milk. The #2 article was myocarditis from the vaccine itself. And #3 was our Johns Hopkins study on natural immunity. What does it say? That the top 3 discussed and circulated research studies of the year were studies that Dr. Fauci either downplayed or did not fund in any part of the NIH.
Well, Republicans are taking over Congress. They say they're going to investigate and get some answers here. I think Dr. Fauci, in his retirement, he says he wants to do public speaking, get affiliated with the university, and write a memoir. It sounds to me like he thinks he's a retiring president, because that's what they all do. But I think Republicans are going to have something else to say about that. What happens with our CDC, with our NIH, with this federal level infectious disease? What happens with him stepping down? Does anything change at all?
Well, first of all, I should say I do think Dr. Fauci has been helpful in warning people about the severity of COVID and encouraging high-risk Americans to get vaccinated. I think he's well-intended, and I personally believe he's a gentleman and he loves this country. But his track record on running NIAID, our National Institute of Allergy and Infectious Diseases, is that of a total failure. And if you look at one of the biggest changes he could make right now in his outgoing on his last day is to get rid of the ban on any staff member at the NIH or CDC speaking to the media. Right now, there's a gag rule that prevents anyone from speaking to the public.
Well, I'll take your word for it that he's a gentleman and an honest broker. What I've seen for the last 2 years, I have questions on a lot of things. But Dr. Marty Makary, thank you so much for joining us. And here's to a life without Fauci.
Thanks, Joe.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.